Hello and welcome to AiArthritis Voices 360. This is the official talk show for the International Foundation for Autoimmune and Autoinflammatory Arthritis, or AiArthritis for short. My name is Leila P.L. Valete, and I am one of your co-hosts today. I'm a person living with lupus and Sjogren's disease, and I am the health education manager here at AiArthritis. And I am joined by two amazing co-hosts, Eileen Davidson and Bridget Seritt. Eileen, if you want to go ahead and give a brief intro to yourself.
Hi, my name is Eileen Davidson. I'm from Vancouver, BC, Canada. I live with rheumatoid arthritis, and I am obviously an advocate for it, but I'm also the educational media assistant with AI Arthritis, as well as a member of the Arthritis Research Canada Patient Advisory Board. A pleasure to be here.
And Bridget?
I am Bridget Surrett, and I am with Advocates for Compassionate Therapy now and a long-term volunteer with AI Arthritis. I'm here in sunny Colorado right now, and I am an advocate for cannabis. I present at medical conferences and do a lot of work on policy.
Awesome. And so today, as you can tell a little bit from our intros, we will be discussing a topic that surprisingly hasn't been brought up on the show since 2020. So, a much needed update on the landscape of cannabis and its role in helping to relieve symptoms in AR arthritis disease is what we will be talking about today. Both Eileen and Bridget let you all know where they're from. I'm living in California, specifically the San Francisco area. Just so you all get some background on where we are. I also wanted to give a disclaimer that we will be giving mostly peer advice today, as all of us do live with arthritis diseases. But Bridget herself is a subject matter expert. Like she said, she presents a lot of scientific information at conferences, and has done a lot with legislative advocacy for cannabis in Colorado in general. So we're super excited to have Bridget back because she actually was on the last two episodes that we had in 2020, that were more focused on CBD, but we're here today to talk about cannabis, and kind of the whole plant. Back then, it did seem like more CBD only was the acceptable form of this plant. But as we are here 5 years later, things have really changed. So I just wanted to catch up the listeners on what has kind of transpired since then. So like I said, the kind of the shift from CBD to cannabis and seeing the benefits of full spectrum cannabis versus just CBD by itself for both pain and mental health management. There's more research, but still lots of questions on the long term safety and the mixing of the um, the plant medicine with our biologics. And just in medical acceptance is growing in the medical field in general with cannabis. Doctors are beginning to discuss prescribing cannabis, and this is a major shift from 5 years ago when the legality and stigma were a little bit more dominant in the conversation. Um, there's a lot more patient reported use, for broader use in terms of pain, sleep, mood, quality of life. Not necessarily just symptom control, but can be a really big complementary treatment along our other treatments that are prescribed. And we're just seeing a lot more awareness and a lot of like more more scientific testing of product testing, making sure that the products that are on the market that we are being sold are a lot more transparent with what's inside them, and more accurate with the dosing, and things like that as well. And yeah, I think one of the biggest things too is the stigma that has changed over these past 5 years. Have both of you seen like a change in the stigma, like both socially and in your medical conversations?
Absolutely. Here in the US, the stigma is definitely changing. It's becoming more and more accepted. Though I will say I have been seeing a lot of blowback in the last 4 or 5 years. Since 2020, we've had a lot of blowback and things are starting to clamp down just a little bit. So, but I think as a whole, it's definitely accepted as a therapeutic tool in the toolbox, if you will.
Absolutely. Eileen?
I would say yes, although I will mention Vancouver, BC has very much been quite for cannabis. It's a known area where cannabis has been popular and grown and things like that. So I think that this stigma has shifted a bit where those who were more against it have actually kind of learned more that it is helping people with different kinds of diseases. And what I notice when I tell people that I use cannabis for my rheumatoid arthritis, they're like, "Oh yeah, of course you need to," kind of thing, right? So, um, I think it has definitely changed. I also find like because we have government regulated stores and they're they're everywhere. Like they're right by my shopping center where I go and get groceries. So,
They look like Apple stores now. Like they just look
yeah,
like a regular retail storefront. They're so nice and fancy with iPads and stuff like that.
yeah, and you don't have to go and get some form filled out by your doctor. So there's a little bit of freedom. However, that freedom can obviously cause some problems because then you might go overboard. But um, I would say with my physicians, however, yes, it has changed. I don't think it's quite there yet where they're like going to prescribe it. It's very kind of ranging from what the rheumatologist or physician um who like how much they have paid attention. And I find like different physicians will be more for it because they understand like our medications also have negative effects too. So it is definitely a difference of opinion, and I don't think the research is quite there yet for those medical professionals to be all for it. We'll talk a little bit more about that in a moment too.
Yeah, they really want that empirical data, that it's very like um repeatable and shown over years of research. So, like, if all of these research studies have only started in the past 5, 6, 8 years, it's still going to be a while before that data is going to be fully accepted, and then even presented to those medical professionals, and then
Hmm.
even more so getting that information spread throughout all of the medical professionals. But we did want to also address the fact that we do know that all three of us do live in more accepted areas of cannabis, so we may be a little blind in our little bubble to how much the stigma is still alive in other places that are not as liberal when it comes to using cannabis. I mean, I live in San Francisco. The Bay Area is known to be one of the top places to get the best cannabis. So that's it's totally different. But I do see in I have medical cannabis on my record, like on my health my chart, and I do see very different reactions from different NPs, doctors, nurses, like when they are confirming my medication list. It's very out of entertainment, I just like to see what their face looks like when they read it off of my chart. Some of them do like look like they're judging, and some of them are a little curious. Like, so if you use medical cannabis, like what form do you use, and things like that. And so I wanted to kind of shift to that conversation of the different forms of cannabis that are out there. There's so many different ways to consume now. It's not just getting a dime bag from the corner and smoking a joint, and that's the only way that you're able to do it. There's, like we said, there's a lot more corporate looking packaging, and it's tested and made in labs and things like that. So yeah, what do you all usually partake in, and how do you see it benefit your symptoms?
So, this is kind of a loaded question because there's no one right way to use cannabis. Each form is going to be different for a different symptoms. You would use edibles, if you want really strong pain relief. If you're nauseous, inhaled might work better for you. Those types of things. Topical is a very popular way. Get your joint cream out and put it on there and rub some in, and it relieves pain that way. So really, it just depends on what's worked for you. I know a lot of folks with autoimmune diseases or GI issues can't use edibles properly, and so they resort to using inhaled flower or concentrates, and they do that with great success. So I mostly use edible, and for nausea, I will use inhaled. And I'm very strict about what kinds I use and whether or not it's tested, and um, also being sure that I use it responsibly as well.
I really don't know if I could top that answer. That was perfect. That was. Much like you. I use edibles for when I'm having a really bad day, and I err with caution when I use edibles because it's very easy to overdo it. Um,
Yes.
so yeah, you do
Last
have
a lot longer too.
yeah, so if I'm not doing anything the next day, then I might try it. I'll do the edibles just because I find that edibles can have a different effect on me than inhalation or obviously topicals. Um, I do find also they take longer to work too. So if I want something more immediate, I would do inhaling. And I also find that I get quite a bit of nausea, dizziness, and that. So and sleep issues, so it does help with that, and I also sometimes have a hard time eating as well, so it can help with that, and also not help with it because it can give me the munchies too, so air I always say, like, "Air with caution." Make sure you're buying from a place that is regulated and, has been properly tested. For me, I go to the government stores because if they're not regulated, then I can blame the government, right?
Yeah, right.
Yeah.
I Go ahead, Bridget.
Just to kind of note, as far as the difference between edibles and inhaled, they are actually two different kinds of THC. And so inhaled cannabis, it does not bind to receptors as long, and so it doesn't last as long, but it's more immediate. Whereas the edible, it's digested by the liver and converted to a different type of THC, which lasts longer and binds stronger. And so whenever you're dealing with edibles, especially your first time, never judge based on your inhaled experience, because an edible can definitely rock your world, and you want to start low and slow. I generally tell patients who are new between 2 and 5 milligrams of THC to see if you are sensitive, because if you take too much, it is not a pleasant experience.
Yeah, definitely. And I think also there's I've had edibles that are, like a ratio between THC and CBD. And just like the addition of CBD to a THC dummy was totally different for me. It like they call it like the entourage effect when you have other cannabinoids that are kind of in whichever form that you're taking. So usually if you have flour, right, it's the whole flour, so those are going to have all of the different cannabinoids. But when we take edibles, sometimes it's mostly just the THC that's extracted and not the rest of the plant. And
Correct.
sometimes it's the rest of the plant, the other cannabinoids that actually really help other parts of the symptoms. Like the THC really more it's like the psychoactive effect. And there may be some other parts of the flower that are more beneficial to other symptoms. So just kind of knowing that it's THC, CBD, and like the whole full spectrum flower, they're all totally different things and can be
Yes.
used for different symptoms. I also wanted to address like the inhalation part because there's also, a lot of talk about, either way, you're still smoking. And so you're still putting something into your lungs. And so there's always the fear that there's going to be, some issues with your lungs in the future. And especially you both living with RA and me living with Sjogren's, we are at risk for ILD. interstitial lung disease. So that is also something to think about when you're thinking about what form to consume. I do prefer inhalation the most, but I've done a lot of research on what the cleanest way to be able to inhale is, and so I've most recently been using like vaporized flower. So I have a like a vaporizer. They call them volcanoes. That's like the name brand that everybody uses.
Mhm.
But I've found that to be the most safe way for your lungs to be able to inhale because you're not burning the flower, you're actually baking it. So it doesn't get to that combustion point where it's creating the smoke that can cause like the soot to get into your lungs. And it's just a little bit more clean. That or also like I would say like a water pipe or a bong can also be a little bit more clean compared to using papers, anything like that when you're smoking. So just keeping that in mind as well if you want to make sure your lung health is in place as well, and also looking into other herbs that you can smoke to help clear out your lungs like mullein, and other complementary herbs that can also be added to your inhalated smoke to kind of help with the effects of what it might do to your lungs.
Absolutely.
I would definitely like to also mention that when I was first diagnosed with rheumatoid arthritis, I didn't really know much about the disease, obviously, and I was definitely kind of confused that RA was an autoimmune disease and a systemic at that point. So when I started inhaling cannabis, I did not know that RA caused lung issues. I wasn't that far into knowing much because when I was diagnosed with RA, we obviously get a ton of unsolicited advice at first, and I felt like there was so much try cannabis, try cannabis, try cannabis because it has, this is 2015, right? So back then it wasn't quite legal, but it was known to help people with pain. So I actually had never tried cannabis except for maybe once when I was a teenager, and I never smoked it. And I didn't start smoking it until I was actually in my 30s. So um yeah, I didn't know that RA could affect the lungs then, and that I think if had I known that, that may have kinda probably would have changed my opinion on where I was at when first diagnosed and starting to try cannabis. So it's really good to educate yourself, and obviously research is always emerging, so I like to say keep up with the current research too.
Absolutely, absolutely. I will say any type of inhaling, it's going to be an issue for lungs. Even if it's vaporized, even, as clean as you can possibly get it, you're still inhaling resin and potentially plant matter into your lungs. And so you do have to be very careful. There's popcorn lung associated with some of the things they use in vaporized, the cartridges and things like that. And any plant matter, regardless of where it comes from, if you're burning that, or even singeing it, it's going to create issues potentially for sensitive lungs.
Absolutely. I've heard a lot. I mean, we've on the nicotine side, people have been using vapes so much for probably the past 10 years, and we're seeing so many side effects from that and the
Yes.
popcorn lung, like what you're saying. People like almost dying going into the ER from how bad their lungs are from using vapes. So just yeah, keeping in mind that your lungs are always going to be infected affected no matter what form that you or what way you're inhaling, it's still inhaling. So knowing that you're putting yourself at that risk, and just being informed. I think the most recent that I've tried again was is topical, and I did not know how instant the relief could be from topical as well. I have a 3-to-1 ratio, the THC to CBD. And I've been using it for my neck pain and my headaches, and it has been significantly helpful. Like my stiff neck, like all around this area, and then I'll put it in my temple, like forehead area, And within 10 minutes, I feel like so much relief. And I was like, man, I just started out using topicals, back maybe like 6, 7 years ago. And I kind of strayed away from it because they're really expensive. It's like $75 sometimes for like a little 1 ounce jar. And so, but I tried it and I couldn't believe how instant the relief was.
Absolutely.
Yeah, I also wanna say I like to layer my pain cream. So I'll use a cannabis topical, and then I'll there's many different kinds of pain creams, Voltaren, I like Kalea. I'm not product placing, but this is what they look like. They're my favorite. And they do have a one with cannabis sativa in it too. So I like to layer because I notice if you add in the 2 forms of pain creams that it's a little bit more effective. And obviously, rheumatoid arthritis is a painful disease, so we need as much pain relief as possible.
I actually was gonna suggest, they're easy to make, and they're much cheaper if you make them, and you can add those extra pain things. If you have lidocaine cream, you could add that to your topical. If you have menthol,
Yeah.
if you have cayenne, however you like your pain cream, I make one that has all of it in there.
That's
And
amazing.
it's way cheap. It's like $5 for 8 ounces, and it's fantastic. So,
I
Oh yeah, we're gonna
I
need that recipe, Bridget. We need
yeah,
to get offline.
yeah. And, if, I've also tried growing my own, so which I don't smoke, I just like to try and grow it, really. Um, and I
She's a
think
gardener.
yeah,
it's fun to grow.
and I just like growing things, even if I don't use it. But yeah, I think I should probably use those for topicals. I think
Yeah, that would be
that's
really awesome. Yeah,
Yes.
I'm totally interested in making our own creams. That's so awesome.
yeah, because we can customize it to our preferences.
Exactly.
Exactly. For sure. Okay, so moving on to the next topic. Eileen and I, a few months ago, went to ULAR, which was in Barcelona, Spain this past year. So it was a really interesting experience that we had the whole time that we were there. It's funny side stories that we had an apartment that had no working AC, and it was probably around 85 degrees the whole time that we were there, and we were on like the top floor. So it was very hot. It was not a fun experience that whole time we were there, but we did learn a lot. We learned a whole lot. And one of the sessions that Eileen went to was actually a debate on whether or not rheumatologists should be prescribing cannabis to their patients. And it was very interesting hearing Eileen's debrief from that session. And I will plug that we do have a program that's going on every time we go to conferences called Go With Us. And so we have Go With Us videos that come out every day while we're at the conference, letting you all know what we learned in patient friendly terms. And so I will link to the page here on the podcast, one, to Eileen's debrief for that specific cannabis debate, and two, for our sign up for Go With Us. Actually, by the time this episode comes out, we will be in the middle of Go With Us, or actually, no, Go With Us will have ended already. So they are all of the public videos from ACR 2025 should be online by the time this episode comes out. So come and check them out on our YouTube channel. We will have lots of new updated information on all things AI arthritis and treatments and all of those kind of things. So just a little plug for that program as we are talking about Eileen's debrief from the debate in ULAR. But basically, they talked about the shift in conversation, like what we were talking about here, that it's kind of moved to just from CBD to medical cannabis, the full spectrum, and talking about a potential prescription therapy for rheumatic diseases, and just reflecting on broader acceptance. And mind you, ULAR is in Europe, so we're not talking about the US specifically, but kind of a little bit more worldwide when this conversation is happening. And so, again, evidence is evolving. It does show that modest pain relief and better sleep and anxiety outcomes are shown, but still, this seems to be only shown in the short term. Not really sure what's happening in the long term yet in terms of research evidence. The pros that were highlighted with cannabis was mainly on reducing reliance on opioids, which is huge in our community because there are a lot of patients who are in so much pain and are taking opioids, pain patches, fentanyl, like all of these different types of hardcore pain medications to help with symptom relief. And so medical cannabis can help with that as well. And so talking about that a little bit more and how that is a pro. Of course, they raised more caution still on cognitive effects, dependency risk, and interaction with DMARDs or biologics, and talked about prescribing versus self management because there is so much patient reported use. How can rheumatologists and healthcare providers in general kind of help to direct patients in the right direction and make sure that they're using safely, and also just talking about access and stigma and all of the legalities in the different countries that were represented at ULAR. So it was really interesting subject matter, but I want Eileen to talk a little bit more since she was there in person to see it, and talk about the result of what they ended up on the debate.
Well, it was very interesting. There were some incredible points brought up on both sides. And a lot of the focus on the against side, which was actually the US, so it's interesting. They spoke about the negative effects, and it was a bit eye-opening to me, some of the negative effects, of course. So there are things to look out for, like psychosis, cognitive impairment, and even high blood pressure. It's a contributing factor to that. So obviously there are negative sides to it, and then, of course, lung issues. Um, that was more the negative side or the against side. I don't know if I would describe it like that. And then the for side, which was actually from Israel, and he raised, I think, what was the most valuable point to me as a patient, and my choice in using medical cannabis, because it should be a shared decision, right, between me and my provider. But he brought up the point that our medications that we are on also cause us problems or can. So it is a decision to make between, I think, the patient and the physician. And I think it's very important for physicians to prescribe proper resources or give us resources. So in the end, it there was some definite focus on also the uptick in ER visits since cannabis has became legalized or easier access in different states, and also accidents and things like that. So I there's obviously no data that's from people living with rheumatic disease, and you have, I don't know any of those numbers, but obviously I think that there needs to be more education on what not to do when on cannabis, and um, also, yeah, just physicians and also the people that are providing, selling us the cannabis should also let us know. So, in the end, it was, yes, they would prescribe it more, but they also were more hesitant about having it legalized. So I thought that was interesting. So I think they just want it more regulated in the end. So it was interesting to see that it was a little bit like after the arguments between the two, there were two rheumatologists, and in the end, it shifted a little, but not too much. So I think in the end, the evidence isn't quite there yet, but research takes honestly decades. So it's really exciting to be in the new research and seeing that, but knowing that we still need more.
Yes, I actually have some. This is a loaded conversation right here. Um, in the United States, you cannot prescribe cannabis at all. Period. In Canada, it's a very different system. Um, But in Canada, they have specific formulations where they concentrate on THC and CBD. And here in the United States, they don't, because it is still federally a Schedule 1 drug. There is no such thing as a provider being able to prescribe cannabis. It's not legally protected. If you do it at your own risk, knowing that the feds still find it illegal. You can't travel with it. You can't cross state lines with it. Um, and even though hemp, which was quasi legalized in 2018 through the Farm Bill, it's still illegal to give your child CBD, even though you can go to a gas station, which you should never do, and buy a product. Um, and just to say, gas station CBD is not good for you, and neither is gas station THC, because you never know what you get. So it's a very difficult situation. Because of the Schedule 1 status in the United States, it cannot be properly researched. And so I know people are saying the research, it's getting there. Not even close. You cannot legally do a study on cannabis in the United States unless you go through the same ridiculous rigmarole you had to go through 20 years ago. So we have not made any progress as far as that goes in the United States. Doctors are very hesitant to prescribe it, A, because it has multi compounds in it. It's not just THC, where they can read a pamphlet and understand the side effects. It's got over 400 different chemical components to it, and it all interacts differently with your body based on what those chemical components are and based on your individual receptor system. Your cannabinoid endocannabinoid system is not like your cardiac system where it has, your heart and, these standard organs. It's a set of receptors that changes daily and even by the minute. And so what works for you one day could be very different the next day, and you could completely react to it. You can overstimulate your system. And so until we can get more actual research, which means a change in laws here in the United States, you're not going to see physicians even recommending it. What they may say is, yeah, go ahead. I have no problem with you doing it, but basically you're on your own, because they could lose their license if they do give you any guidance. They can't talk about terpenes, they can't talk about the different cannabinoids, because that is giving medical guidance on a Schedule 1 drug. It's still in the United States in a very precarious s- situation, and patients are pretty much on their own learning how it works. And the sad thing is, it does interact prolifically with medications. You can't take seizure medications and edibles at the same time. You will have a toxicity and potentially end up in the hospital. CBD interacts with so many medications, and it's more than the grapefruit indication. It's not a mild indication. We've had pediatrics end up in the hospital with toxicities because their parents had no idea, because the doctors won't tell them because they're scared of losing their licenses, and our bud tenders have no clue what's going on, and legally they're not allowed to give you medical advice. They're just there to sell you something. So it's definitely a situation.
Yeah, it's why it's so important to fight for legalization, right?
Mhm. Mhm, and I didn't know a lot of that because, I'm in Canada, so we do have medical cannabis clinics here where you can talk to a physician, an actual
Yes.
physician. So it is quite different, but this is the International Foundation of Autoimmune and Autoinflammatory Arthritis. So we have to also speak from a international perspective. And I really do hope that the US does catch up on some of the research that other countries and continents are doing. Um, but yeah, you raised some very valuable points, and that information that you raised is so hard to find on the internet, and there's so much misinformation out there.
Oh, yes. Yes.
Yeah,
It's
because
wild.
it's very interesting because you can go into, like if you go into the dispensaries here in California, they'll ask if you have a med card, and because sometimes you can get, a little bit percentage off or something like that if you are, an actual patient that has cannabis card, but what is that like? What like how do those physicians give you the medical card, or like the medical card, if they're not supposed to be able to prescribe?
Generally, they are recommending. So,
Got it.
yeah, there's a big difference between a recommendation and an actual prescription. As far as legal goes, very big difference as far as um, how you operate with it. And what they can do for you. It's a very big difference. And so, what you see is a lot of these doctors are retired, and
Mm,
because it's cash pay, there's no insurance involved with any of this. So everything is out of pocket. This is a way for them to make a good bit of money. And so, as you're retired, because theoretically speaking, the federal government of the United States will not interfere with you if you are just recommending and you are following state law. That may change because that's at the whim of the federal government.
mhm.
So there's some safety in it, though I have seen the federal government come after doctors and states.
Wow. That is very interesting to know, because I think that in general you think, okay, if there's a doctor, saying that I can get this card, that they're saying that it's that they're prescribing it to me. So I'm glad that you clarified that, because I had no idea either. So I think that that's super
Yes.
interesting.
I think doctors, we also have to be very careful because doctors do not practice law. And we have an issue here in Colorado with doctors telling parents they can give children CBD because it was technically legalized, and those are air quotes. Um, you know, And it wasn't. CBD actually had a prescription drug ruling prior to the Farm Bill being passed. And so if you give your child CBD, even if there's no THC involved, you are violating state law and child endangerment rules. And we've had plenty of parents picked up just for CBD isolate without a test. They were reported and they didn't realize that it was still illegal to give your child CBD unless you are on Epidiolex, which is the prescription, or you are registered in the state medical marijuana program.
Wow, that is crazy, because yeah, we hear a lot about, especially for epilepsy, and seizures and all of those types of things, that it's been recommended for kids to, take those things. So very, very interesting to know the legal side of it, because although it may be medically recommended and you see the benefits of it, does not mean that it's legal, like what you said.
Yes, yes, and you have to protect your family, and in a lot of cases, we've had families find out the hard way, and we've had to get them their registration cards really quickly, um, you know, and then they get put on a parenting plan for a year. That's generally what happens if you get busted giving your kid a prescription without a prescription. So it's always good to know that your doctor may mean well, but they do not practice law. So don't take legal advice from your physician.
Yeah, they spend a lot of money and a lot of time specializing in medicine and not in law.
Yes, yeah,
That
just
is
like I wouldn't take, medical advice from my
advice from a
lawyer.
lawyer. Yeah,
So
for sure. Absolutely. Well, this was a really productive conversation in terms of, yeah, the access versus stigma versus legality. There's so much there to unpack, but I think the takeaway point is that the legalization and moving that from a schedule 1 drug is super important to be able to test the safety, efficacy, and have those real research numbers, because it's impossible to do that without having if you still have that red tape from the federal government.
yes.
Well, definitely. Okay, so we're going to move on to our last subject, which is just giving some peer guidance on anybody who might be curious on cannabis. Just kind of your last thoughts on what you would recommend, and maybe what, a little bit from your experience still, like on how what specifically it's helped with, anxiety, sleep, pain, all of those different things. And Yeah, what is your advice to someone who is looking to start their cannabis journey, and what kind of heads up would you want to give someone who is new and to this subject?
Well, I would definitely say, do your research. Project CBD actually has a really good primer out that discusses the interactions and the different pathways between medications. You can email it to your pharmacist, have them check, because there are multiple ways that cannabis can interact with your body based on, whether it's in the liver or if it's, on a specific um, neurotypical pathway. So definitely check for interactions. Always start low, and just start researching and start talking to other people who have cannabis. I've found that so many people want to share their experiences, and want to get that information, but they just don't know where or how or who to ask. They ask their doctors, and the doctors don't know. Right now, the patients are the most educated as far as this goes, and so I would definitely connect, talk about terpenes, talk about the different cannabinoids, and as far as pain goes, I don't necessarily use cannabis for pain, because my pain is just stupid and off the charts. So I actually use cannabis for nausea and for its anti-inflammatory impacts. And that was one of the great things coming out of Israel is the research on how anti-inflammatory cannabis is. It actually works on your T cells, which is the same way that many of our biologics work. And so it can be a great
Wow,
complementary therapy for you to use. I know not everybody will find relief, but it could prevent you from having to add another prescription. I was able to get off 9 different prescriptions. And so now I only take my biologic, which
that's
is
amazing.
fantastic. So, yay, no more prednisone unless it's a respiratory infection kind of. And I function now. I'm back at work. I'm in my community doing things, and it has really changed my life for the positive.
That's a really incredible story. And I love to hear that. And I agree with everything that you have said. The only thing I would raise concern about is this is an ongoing cost, right? Cannabis, good quality cannabis is costly. So I think also consider that before you, you dive into something and you want to try something long term, that you have to ask yourself, can you afford this? And also making sure that you are buying one that has credible um, reviews and clean and whatnot. So I think that's the only thing that I would really recommend other than, go slow. I always say do it at nighttime when you're not doing anything, obviously. And yeah, if you have any uptick in symptoms, however you like to track your symptoms, everybody's kind of different. Some people have a journal, some people have apps. So whatever works for you, keep track of those symptoms. I will usually say, I like to say that it's a lot like our medications. The negative effects might kind of last in the first few weeks, and then you get the benefits, kind of thing. So some people may it take like I think it like takes time for our bodies to adjust and get used to it. Um, but and I agree, it doesn't necessarily topical helps best with pain, but we have to remember that RA and our medications, RA is systemic autoimmune disease. It's not just joint pain. We often feel like we have the flu all the time. So it can really help with that. And yeah, with sleep, anxiety. And one thing that I found after I started using cannabis is it actually helped me with creativity. So um, there are some like benefits for my health, but also my mental health with the being more creative and yeah, it does, and obviously helping me get more sleep at night. So
Oh, yeah, absolutely. I do want to mention here um, that when you're tracking your symptoms, understand that it's not just the cannabinoids that are going to be contributing. You have terpenes, which are, to very much oversimplify it, think about what you're smelling. And you can have dozens of these in any particular strain. There's not one standard strain, like Gorilla Glue doesn't have specifically these terpenes. Um, I found that pinene will actually raise my heart rate worse than THC will. THC is known to raise heart rate, um, but it also can lower heart rate depending on how you use it. Inhaled is generally raising the heart rate. Edible generally tends to lower your heart rate. So if you have something like postural orthostatic tachycardia syndrome, you really want to be careful and know what is in your cannabis. And you really want to approach this from the same mentality that you would taking a prescription. You know, look at what the potential interactions are, look at how things are going to work with your body, and then listen to your body. I found I can't use pinene, I can't use CBD, it causes tremors for me. And I also cannot use linalool, which is supposed to be a relaxing terpene. I think I'm allergic to it. Um, so I have to be very particular about what I get. But it took me almost 2 years of researching, figuring out, journaling, and understanding how cannabis works in order for me to find the right mix for my body.
Wow, that's awesome to have to hear that you've been able to kind of do the trial and error and research of all of those things. I think that from my perspective, my consistent use of cannabis has also aided in, like you said, the anti-inflammatory effects. I have been in like clinical remission. Like still my blood, some of my blood markers um, are always going to be there for my lupus, like complements and double-stranded DNA. But my complements specifically have gone normal, like in the past 4 years, and I think that's around 5 to 6 years is when I started using cannabis consistently. I also it also has helped so much with my mental health journey and anger issues, specifically. Just being able to really let loose. I used to think that I would be more like on edge, on very irritable, very easily upset, and just like using cannabis consistently has really helped to mitigate a lot of those mood issues that I had for a very long time. And even just being able to really feel what you're feeling. I think that it's different. Like when you're using cannabis, I think you're able to feel things a little bit more, rather than being able to try to brush it off and try to like power through and things like that. Cannabis really helped me to sit in my feelings and really feel what I was feeling, rather than kind of like just pushing it away. So I think people may have that thought that, oh, you're using this to get away from whatever is happening, and it a lot of the times it's actually the opposite. It makes you really like sit and think about it and address those feelings that you're having, especially like I said with anger. That was like a lot of what cannabis helped me with, on top of anxiety as well. I think I've had incredible anxiety my whole life and always have been on edge. And ever since using cannabis consistently, that has gone away a lot. Um, Also the Wellbutrin that I've been taking as well. That's also helped even more so. But that was that. Everything is with cannabis. It's complementary. It helps with all of the other additional to all the other medications that you are taking, and shouldn't be a complete replacement. That's not what we're advocating here for at all. So that's the biggest thing, is still making sure that you're staying on the medications that are prescribed to you and using those properly. And again, having conversations with your physicians, even though they cannot prescribe. We know that today. There may be physicians that are still open to having conversations about recommendations on your specific case and your specific disease. So just making sure to have that open conversation. I would love to be able to get some more resources from you, Bridget, to be able to put in the description of this episode as well. Maybe some education, learning more about cannabinoids, terpenes, and all of those different things, so that we can have like a maybe a landing page on our website as well for more resources on cannabis. So me and Eileen can talk to you offline about getting that up, because that's something that we've been wanting to do for a while now. Eileen is the one who mostly does a lot of our website pages. So I think that this would be a really awesome resource for us to add into our patient journey, which we have resources basically that are supposed to help patients anywhere on your disease journey, from mystery patient, newly diagnosed, all the way to the road to remission. So I think that this could be a really cool and amazing resource for our patients to have as well.
Fantastic. I actually do have handouts and one pagers and lots of things I can send to you.
Awesome.
Yeah, I think that's a great idea. And I will also do a deep dive for any research papers that I can find on it.
Yes, yeah, we will, let's definitely put together a cannabis hub for us to be able to put some resources out there for patients that are listening. And thank you both, Eileen and Bridget, for being here with me today. Um, at AI Arthritis, we don't just represent the patient voice; we are the patient voice. And with your support, we can amplify it even further. If you found value in this talk show, consider making a donation to help us continue producing impactful conversations, bringing all stakeholders to the table to discuss patient identified issues and patient infused solutions. So you can visit aiarthritis.org/donate to help us make a difference together. And thank you for tuning in to this episode of AI Arthritis Voices 360. Um, Again, Bridget and Eileen, thank you for being here today. And if you can, please let the audience know where they can find you. If you have social media that you wanted to plug, or your website, or your or an organization, anything that you'd like the audience to be able to kind of maybe find you and get some resources from.
Excellent. I do have a website at Advocates for Compassionate Therapy .com. But I'm hoping to get everything on the AI Arthritis website because they are going to be the best resource for anybody with autoimmune arthritis. And I think this is not going to go away. Cannabis is just going to become more and more popular as people realize that it can help them in ways that other things cannot. And I think it'll be a valuable resource.
Awesome.
Awesome. Thank you for sharing your link. I'm definitely going to have to check it out. You can find me online under Chronic Eileen. Eileen is spelled Eileen. And the chronic is for chronic illness, not chronic as in chronic smoker. Uh, and yeah, so I have a website, blog, www.chroniceileen.com, and on Facebook and all the other programs that are for social media, I'm on as Chronic Eileen. And I'm also the educational media assistant with AI Arthritis. So you can find me building websites and doing other things with the organization.
Yes, and same with me. I'm here all the time. You see me as the co-host here for the Voices 360 talk show, and all of the different Go With Us videos on AI Arthritis's platforms. But I also do have my own TikTok and Instagram where I advocate and share my experiences with other lupus and Sjogren's patients. And that's at lupus.lifestyle.lay on both TikTok and Instagram. If you are looking to see a little bit more into my life with lupus. And yeah, that's a wrap. Thank you again for everybody for listening, and to Bridget and Eileen for being here today. And we'll see you next month. Bye.